I am Dr. Madhusudan, the Managing Director of Transport Solutions. And coming to me, I am in this field for the past 20 years and I trained 195 batches in medical coding, and in medical transcription also I trained 108 batches in medical transcription. Now coming to medical coding, I am CPC certified, that is Certified Professional Coder, COC certified, Certified Outpatient Coder, CIC certified, Certified Inpatient Coder, CPB certified Professional Biller. Like that I am certified in 15 specialties and I have 20 plus years of experience in this particular field. Okay. Today we discuss about what is medical coding. Medical coding ante enti, medical coding chese valla job responsibilities ela untayi, ee work nature ela untadi, all these things today we will discuss. So first of all, you need to understand one thing. Though you are sitting in India, you are not working for India, you are working for United States of America. So you are not working for India, you are working for United States of America. For that reason, no need to understand anything about Indian healthcare system. You need to understand about American healthcare system. So today we are going to discuss about American healthcare system. In revenue cycle management, what is happening? If you take American healthcare system, you come across 3 P's, which means one P is for the patient, another P is for the provider, another P is for the payer. Means patient, provider and payer. Patient means we all know who is suffering from a disease. Provider means who provides services to the patient, nothing but a doctor. Now, payer means who pays money, nothing but insurance company. It is not life insurance company, it is health insurance company. So, first of all, a patient, payer and provider. In United States of America, almost each and every patient try to take one policy, that is health insurance policy. In United States of America, almost it is a basic need to take a health insurance policy. Now, whenever a patient gets any disease, he goes to the provider. Provider means doctor. And the provider provides services to the patient, but no exchange of money takes place here. Means the patient will not pay any money to the doctor, or doctor will not ask any money from the patient. After providing services to the patient, this provider or this doctor, he claims money from the insurance company because the patient is having policy with the insurance company. For that reason, this provider or this doctor, he need to submit proper proof of treatment or proper documentation to the insurance company. So to submit that proper proof to the insurance company, first of all, he need to maintain all the documentation. As this doctor is very busy with the patients, he takes the help of 3 departments in maintaining the documentation. Those 3 departments are medical transcription department, medical coding department and medical billing department. Means a medical transcriptionist, a medical coder and a medical biller. These 3 people will be assisting the doctor or assisting the provider in maintaining the documentation. Why he need to maintain the documentation? He need to submit it to the insurance company. Why he need to submit it to the insurance company? He need to get money from the insurance company. What is that money? The cost of treatment provided to the patient. Why insurance company is paying money? Because the patient is having policy with the insurance company. So this is the first basic thing you need to understand. Now, we will discuss one by one what is happening in medical transcription, medical coding and medical billing. Now, coming to the medical transcription department. Now, see, here a provider or doctor is depending upon 3 departments. One department is medical transcription, second department is medical coding, third department is medical billing. Now, coming to first department, that is medical transcription department. In medical transcription department, let us imagine this side United States of America and this side India. First, what is happening in USA? What is happening in India? In United States of America, the doctor is present as well as patient is also present. See, doctor, patient, insurance company, everything is present in USA only. Nothing is present in India. You are only present in India. You are only sitting in India working for America. Now, the doctor is providing treatment to the patient. After providing treatment to the patient, this doctor dictates each and every detail about the patient, which means the patient is a 25-year-old, male or female, came with the complaints of what, all these things the doctor will dictate. All this dictation will be recorded. It will be recorded in a recorder, like it may be in a tab, it may be in a phone, or it may be in a computer. It will be recorded. This record in the voice file antam. We call it as a voice file. We receive this voice file to India. India ki manam ee voice file ni receive cheskoni India lo oka medical transcriptionist, he listens that voice file with the help of earphones pettukoni vini, he will be typing it in MS Word document that is called text file. So, simply speaking, conversion of this voice file into this text file is called medical transcription. But here the voice should be given by a doctor, then it is called medical transcription. Now, this medical transcriptionist is new to the industry. He may be committing some mistakes here. That is the reason why another person called proofreader will be present. This proofreader again listens the same voice file and he finds out the mistakes present here and he corrects those mistakes. After that, one more person called editor. కొన్ని కంపెనీల్లో QA అంటాం, కొన్ని కంపెనీల్లో QC అని అంటాం, quality analyst or quality control. This person again edits the entire document and he provides 100% accurate text file. So in India, 100% accurate text file is prepared and this text file, again we send this text file to the doctor who is present in United States of America. Means, what is happening in USA? What is happening in India? In United States of America, first treatment, then dictation, recording, preparation of the voice file. Receiving this voice file to India and converting this voice file into text file in different stages like medical transcription, proofreading and editing, and we are sending this text file to the doctor who is present in United States of America. This is the first department, that is medical transcription department. With this uploading of the text file, the first department, that is medical transcription department, is over. Means, we are downloading the voice files to India and we are converting this voice file into text file and we are uploading those text file to the doctor who is present in United States of America. So with this, the first department is over, that is medical transcription department is over. Now, this text file is going to whom? The doctor. Doctor will see the text file and he gives his approval. Once it is approved by the doctor, it will go to the second department. That second department is called medical coding department. See, first of all, let us see the graphical representation of medical transcription. Globe ki itu side USA lo doctor treatment అయిన తర్వాత రికార్డ్ చేస్తున్నాడు. ఆ రికార్డింగ్ అంతా రికార్డ్ అవుతుంది. గ్లోబ్ కి ఇటు సైడ్ ఇండియాలో ఒక అమ్మాయి కూర్చొని దాన్ని టైప్ చేసి పెడుతుంది. So this is a graphical representation of a medical transcription. Now, before discussing about medical coding, we discuss what is meant by coding, then we go to medical coding. First of all, coding anagane don't think that it is C, C++, Java, Oracle, alantidi kaadu. Simple coding. What is this medical coding ante? Conversion of the alphabetic value into numeric value. Conversion of alphabetic value into numeric value is called coding. Nothing but, what is alphabetic value? A, B, C, D up to Z. It is 0, 1, 2, 3 up to 9 is the numeric value. The best example for this is a pin coding system. Pin coding system. See, take for example, if it is Hyderabad 500016 or something like that. If it is Chennai, another number. If it is Mumbai, another number. If it is Delhi, another number. See, here Hyderabad is present in alphabetic value. 500016 is present in numeric value. This is nothing but coding. If someone is asking you to define the pin coding system, how do you define? Assigning codes or assigning numbers to different areas is nothing but a pin coding system. In the same way, what is medical coding system? Medical coding, in any coding system, you are assigning codes only. In pin coding system, you are assigning codes to areas. In medical coding system, you are assigning codes to the diagnosis, codes to the procedures, and codes to the materials. First of all, let me explain you. Medical coder. First, medical transcriptionist వాయిస్ ఫైల్ని టెక్స్ట్ ఫైల్ లాగా కన్వర్ట్ చేశాడు, రైట్? ఈ టెక్స్ట్ ఫైల్ మీద ఎవరు అప్రూవల్ ఇచ్చారు? డాక్టర్. ఈ టెక్స్ట్ ఫైల్ ఎవరి దగ్గరకు వచ్చింది? మెడికల్ కోడర్. నౌ కమింగ్ టు ద రెస్పాన్సిబిలిటీ ఆఫ్ ఎ మెడికల్ కోడర్. మెడికల్ కోడర్ రిసీవ్డ్ దిస్ టెక్స్ట్ ఫైల్ which is transcribed by the medical transcriptionist and which is approved by the doctor. Clear up to here? Now, medical coder, no need to listen anything. Listening is the responsibility of a medical transcriptionist, not the medical coder. Now, medical coder need to read this document. He need to analyze this document. He need to understand this document. And finally, he need to identify what are the diseases present to the patient. Patient కి ఏమేం జబ్బులు ఉన్నాయో ఐడెంటిఫై చేయాలి. ఐడెంటిఫై చేసిన తర్వాత for each and every disease, he need to assign one code number. Just like for each and every area, we are assigning one pin code number. ఒక్కొక్క ఏరియాకి మనం ఒక పిన్ కోడ్ నెంబర్ ఎలా ఇస్తున్నామో అలాగే ఒక్కొక్క డిసీజ్కి ఒక్కొక్క కోడ్ నెంబర్ ఇవ్వాలి. మరి ఇక్కడ చాలా డిసీజెస్ ఉంటాయి కదా, ఈ డిసీజ్ అన్నిటికీ కోడ్ నెంబర్లు దేంట్లో ఉంటాయి అని అంటే ICD-10CM అనే బుక్ లో ఉంటాయి. సో దిస్ ఈజ్ ICD-10CM బుక్. దిస్ ఈజ్ ICD-10CM బుక్ which consists of codes for what? Diagnosis. Diagnosis ki code numbers ఎందులో ఉంటాయి? ICD-10CM. You need to use the current year books only. This is 2025. That is the reason why we are using 2025 book. Okay. Don't get scared by seeing this book. ఈ బుక్ చూసి భయపడకండి. ఓకే, ఎందుకు అని అంటే no need to by heart anything from this book. And this is just like a dictionary. You are using this book. అండ్ ఎగ్జామ్ లో కూడా మీకు ఈ బుక్ ఇస్తారు. ఈ బుక్ చూసి మీరు ఎగ్జామ్ రాయాల్సి ఉంటుంది. దాన్ని ఓపెన్ బుక్ సిస్టమ్ అని అంటారు. దట్ ఆల్ ఐ విల్ ఎక్స్ప్లెయిన్ యూ లేటర్. ఓకే, నౌ కంటిన్యూ రీడింగ్ ద సేమ్ డాక్యుమెంట్ అండ్ ఐడెంటిఫై ద ప్రొసీజర్స్ పర్ఫార్మ్డ్ బై ద డాక్టర్. ప్రొసీజర్స్ అంటే సర్వీసెస్. మీన్స్ డాక్టర్ ఏమేమి సర్వీసెస్ చేసి ఉండొచ్చు? అనస్థీషియా ఇచ్చి ఉండొచ్చు, సర్జరీ చేసి ఉండొచ్చు, రేడియాలజికల్ ప్రొసీజర్ లైక్ ఎక్స్రే, సిటీ స్కాన్, ఎంఆర్ఐ, అల్ట్రాసౌండ్ లాంటివి తీసి ఉండొచ్చు, లేదా ల్యాబొరేటరీ టెస్ట్ లైక్ బ్లడ్ టెస్ట్, యూరిన్ టెస్ట్ లాంటివి చేసి ఉండొచ్చు, లేదా ఇంజెక్షన్ ఇచ్చి ఉండొచ్చు, అండ్ ఐవీ ఫ్లూయిడ్స్ ఇచ్చి ఉండొచ్చు, వ్యాక్సినేషన్స్ ఇచ్చి ఉండొచ్చు, ఆప్థాల్మాలజీ టెస్ట్ చేసి ఉండొచ్చు, ఈసీజీస్ తీసి ఉండొచ్చు. ఫర్ ఆల్ దీస్ థింగ్స్, దీస్ ఆర్ ఆల్ కాల్డ్ ప్రొసీజర్స్. ఈ ప్రొసీజర్స్ కి కూడా కోడ్ నంబర్స్ ఇవ్వాలి. ప్రొసీజర్ రిలేటెడ్ కోడ్ నంబర్స్ అన్ని ఎందులో ఉంటాయి అని అంటే CPT అనే బుక్ లో ఉంటాయి. ఈజ్ ద బుక్ విచ్ కన్సిస్ట్ ఆఫ్ కోడ్ నంబర్స్ ఫర్ ద ప్రొసీజర్స్. ICD-10CM is the book which consists of code numbers for the diseases. CPT consists of code numbers for the procedures. Continue reading the same document and identify whether doctor provided any materials to the patient or not. Material and tablets, injections, disposables, durable medical equipments, syrups, rods and plates used in orthopedic surgeries, spectacles, wheelchairs. For all these things, you need to assign code numbers for the materials. That is from a book called HCPCS. So HCPCS is the book which consists of code numbers for the materials. Summing up, what is medical coding? Medical coder no need to listen anything. Listening is the responsibility of a medical transcriptionist. Medical coder receives a text file which is transferred by the medical transcriptionist and approved by the doctor. He need to read the document, he need to identify the diseases and he need to assign code numbers for each and every disease from a book called ICD-10CM. And continue reading the same document, identify the procedures and assign code numbers from a book called CPT. Identify the materials and assign code numbers from HCPCS. With this, the responsibility of a medical coder is also over. Now, after that, what happens? Medical billing department. Coming to the medical biller, he will streamline all the data and he will fill the necessary health insurance forms and he will submit it to the insurance company. What is mean by that? Medical biller streamlines the data and fills the necessary health insurance forms and he submits it to the insurance company. So ఈయన ఏం చేస్తాడు, ఇన్సూరెన్స్ కంపెనీకి సబ్మిట్ చేస్తాడు. మెడికల్ ట్రాన్స్క్రిప్షనిస్ట్, మెడికల్ కోడర్, మెడికల్ బిల్లర్. మెడికల్ ట్రాన్స్క్రిప్షనిస్ట్ ఏం చేస్తాడు, హీ కన్వర్టెడ్ ద వాయిస్ ఫైల్ ఇంటూ టెక్స్ట్ ఫైల్. మెడికల్ కోడర్ ఏం చేస్తాడు, హీ అసైన్డ్ కోడ్ నంబర్స్ టు ద డిసీజెస్, కోడ్ నంబర్స్ టు ద ప్రొసీజర్స్, కోడ్ నంబర్స్ టు ద మెటీరియల్స్. మెడికల్ బిల్లర్ ఏం చేస్తాడు, హీ ఫిల్డ్ వన్ ఫామ్ అండ్ హీ సబ్మిట్స్ దట్ ఫామ్ టు ద ఇన్సూరెన్స్ కంపెనీ. ఇక్కడ ఇన్సూరెన్స్ కంపెనీలో కూడా మెడికల్ కోడర్స్ అండ్ మెడికల్ బిల్లర్స్ ఉంటారు. దీస్ మెడికల్ కోడర్స్ అండ్ మెడికల్ బిల్లర్స్ receive the form submitted by these medical coders and medical billers, and they scrutiny each and everything. If everything is correct, they will pay money to the doctor. If everything is correct, they will pay money to the doctor. Now we got payment for one patient. Next, second patient is waiting outside, who is having policy with the insurance company. He came to the doctor, that is provider. Provider provides services to the patient. After providing services to the patient, he dictates the details. Those details will be converted into voice file. A voice file medical transcriptionist దగ్గరికి వెళ్తది. Medical transcriptionist will convert that voice file into text file. Then it will get the approval of the doctor. Then it will go to the medical coding department. Medical coder assigned code numbers to the diseases, code numbers to the procedures, code numbers to the materials. And then it will go to the medical billing department. Medical biller will submit the form to the insurance company. Insurance company will pay money to the doctor. Third patient is waiting outside, who is having policy with the insurance company. He came to the doctor. Doctor provides services to the patient. After providing services to the patient, medical transcription, medical coding, medical billing, submitting the form to the insurance company and getting money from the insurance company. Fifth patient is waiting outside, who is having policy with the insurance company. He came to the doctor and the doctor provided services to the patient, and then medical transcription, medical coding, medical billing, then submitting the form to the insurance company and getting money from the insurance company. Like that, let us imagine today 100 patients are present. For all 100 patients, you need to follow the same methodology. This is the reason why this much of employment is generated in this medical coding. So total ga summing up చేద్దాం, అంటే మొత్తం ఒకసారి చూసేద్దాం. First of all, doctor responsibility ఏంటి? He will treat the patient, then he will dictate the details and the preparation of the voice file of the patient. Then మెడికల్ ట్రాన్స్క్రిప్షనిస్ట్ ఏం చేస్తాడు, he will convert that voice file into text file. Then medical coder ఏం చేస్తాడు, he will assign code to the diseases, procedures and materials also. Then medical biller ఏం చేస్తాడు, he will data gathering and submitting the form to the insurance company. Then insurance company ఏం చేస్తుంది, it will scrutinize the data and it will pay money to the doctor. So this slide represents the total healthcare system, that is revenue cycle management, what is happening in medical transcription, medical coding and medical billing, what is happening in the insurance company also. So this is about medical, what we call coding. Now I'll take a small case sheet and I'll explain you how the system will work. Now see, this is one case. This is a very simple case. మీకు రియల్ టైంలో కేసులు ఇంత సింపుల్గా ఉండవు, బట్ మీకు అర్థం అవడం కోసం నేను చాలా సింపుల్ కేసు తీసుకుంటున్నాను. ద పేషెంట్ ఈజ్ ఎ 29-year-old female, came with the complaints of abdominal pain in the right lower quadrant, fever, nausea with vomiting. Here, what is the diagnosis? Diagnosis is acute appendicitis. Procedure performed is laparoscopic appendectomy. This is the case. And మళ్ళీ ఒకసారి చెప్తున్నా, కేసెస్ ఎంత సింపుల్గా ఉండవు, మీకు అర్థం అవడం కోసం నేను చాలా సింపుల్ చేసి చెప్తున్నా. ఓకే, నా ఈ కేసులో డయాగ్నోసిస్ కి మనం ఎక్కడి నుంచి కోడ్ నంబర్ ఇవ్వాలి, అక్యూట్ అపెండిసైటిస్. ప్రొసీజర్ కి ఎక్కడి నుంచి కోడ్ నంబర్ ఇవ్వాలి, లాప్రోస్కోపిక్ అపెండెక్టమీ. రైట్, నౌ ఐ విల్ షో యూ. దిస్ ఈజ్ ICD 10cm book. In this ICD 10cm book, we need to assign code number for acute appendicitis. For acute appendicitis, what is the code number? K35.80. acute appendicitis, K35.80. K35.80 is the code number for acute appendicitis. Now coming to laparoscopic appendectomy. This is appendectomy code number. ఇక్కడ appendectomy 44950. This is appendectomy. Excision in the sense it is a open process. Appendectomy can be done in two methods. One method is cutting, opening, removing the appendix and suturing. This is called open method. Open method lo appendectomy cheste 44950. అదే మనం ఈ కేసులో చేసింది లాప్రోస్కోపిక్ ఓపెనా అంటే లాప్రోస్కోపిక్. ఇది చూడండి, లాప్రోస్కోపిక్ సర్జికల్ అపెండెక్టమీ. వాట్ ఇస్ ద కోడ్ నంబర్ వీ నీడ్ టు గివ్? 44790. సి దీస్ ఆర్ ఈ బుక్స్ అని అంటాం వీటిని. మనం నార్మల్గా ఎంతమంది నేను బుక్స్ చూపించాను, కానీ ఏపీసీ ఏం చేస్తుందంటే ఈ ఇయర్లో ఆ నార్మల్ బుక్స్ అన్ని తీసేసి ఈ బుక్స్లోకి వెళ్తుంది. దీస్ ఆర్ ద ఈ బుక్స్. ఈ బుక్స్లో కూడా మనం ట్రైనింగ్ ఇస్తున్నాం. ఈ బుక్స్లో మనం ఎలా చూడాలి అనేది కూడా మనం ట్రైనింగ్ ఇస్తాం. సో ఇప్పుడు మనం ఇవ్వాల్సిన కోడ్ నంబర్ ఐసిడి నుంచి కోడింగ్ ఇవ్వాలి, సిపిటి నుంచి కోడింగ్ ఇవ్వాలి. సిపిటి నుంచి కోడింగ్ ఏమో 44970. ఐసిడి నుంచి కోడ్ నంబర్ ఏమో దట్ ఈస్ K35.80. సో దిస్ ఈస్ ద కోడ్ నంబర్ ఫర్ డిసీజ్ అండ్ దట్ ఈస్ ద కోడ్ నంబర్ ఫర్ ప్రొసీజర్. ఓకే, సో దిస్ ఈస్ అ సింపుల్ కేస్ ఆఫ్ any patient. Still, if you have any doubt, so contact to the numbers given here, and you can call to our front office people and you can get it clarified. లేదు మీరు నాతోనే మాట్లాడాలనుకుంటే మీరు ఫ్రంట్ ఆఫీస్కి ఫోన్ చేయండి. ఫోన్ చేసి వాళ్ళ దగ్గర అపాయింట్మెంట్ తీసుకోండి. మీరు ఏ టైంకి అపాయింట్మెంట్ కావాలంటే ఆ టైంకి నేను అవైలబిలిటీ ఉన్నప్పుడు మీరు వచ్చి నన్ను కలవచ్చు. మీరు నాతో డైరెక్ట్గా మాట్లాడవచ్చు. మీకు ఏ డౌట్ ఉన్నా కూడా నేను చాలా ఓపికగా కూర్చొని క్లారిఫై చేస్తాను. Thank you very much. Thank you.